Hi there. Welcome to our special Arthritis Foundation Policy 101 training. This time we're talking about step therapy reforms. A lot of people living with arthritis depend on nearly every aspect of the healthcare system, from accessing your specialists and doctors and prescription drugs, all the way to medical research that will lead to better treatment and ultimately a cure. A key priority for the arthritis community that policymakers can address right now includes step therapy. Now, you may be asking, what is step therapy? Step therapy is also known as fail first. This is a practice that many health insurance companies use that requires patients to try certain therapies or treatments preferred by that insurance company before they will approve the medication or the treatment that your doctor originally had prescribed. The issue is that when it's used inappropriately, step therapy could really undermine that clinical judgment of healthcare practitioners, providers, and can ultimately put the health and unnecessary risk upon the patient. A lot of you have maybe experienced this and might not even be aware. This is when many patients must try multiple drugs before finding one that works, and therefore giving you the ability to remain on a drug that works is just so critical. So let's walk through a patient example here. So imagine that you have just gotten your arthritis diagnosis. You are looking forward to starting a new biologic treatment. You finally have a diagnosis, and your doctor has prescribed you a prescription that you're pretty excited about. Maybe you're feeling a little anxious or nervous, but you're really feeling hope. You've got this diagnosis, you've got a drug. Let's go to the pharmacy and pick it up. However, when you arrive at the pharmacy, to fill your prescription, the pharmacist has told you at the counter that the insurance company won't cover your medication and you must try another one first. You might be confused and wondering what in the world is happening. And this is step therapy protocol. You might have to walk through or step through one or multiple medications that are preferred by your insurance company before they will agree to give you the product that is the one your doctor originally prescribed. Um, a lot of people experience this after months of trying different drugs on that insurance plan's preferred drug list, that you might finally get that drug that was originally prescribed for you. The problem is that the impact to you and other patients experiencing that long wait time can have really negative effects on your well-being, your personal health, and your arthritis condition itself in the long run. A survey of over 1,400 arthritis patients and caregivers conducted by the Arthritis Foundation revealed that over 50% of patients have had to try at least two or more drugs before getting the one their doctor originally prescribed. And in over 39% of cases, the step therapy was stopped because the drugs just weren't effective. And 20% of the time caused disease worsening. Your condition got worse because of the step therapy products that the insurance company required you to take. So, what is the Arthritis Foundation doing? The advocacy focus really is looking at state and federal bipartisan reforms that will help to streamline appropriate use of step therapy protocols for patients with your health insurance plans. There are three really key components that we're looking for in these bills, but they all establish transparency to create a clear exceptions process for when it is appropriate to use step therapy and when you should skip it. It creates a quick and reasonable time frame so you know when to expect to get a decision when you're overriding or challenging, issuing an appeal. And the third is to be informed. We want the health insurance companies to consider not only the patient's medical history, but also the doctor's knowledge, their experience working with you, especially, but also their medical education and their best judgment. That relationship between the patient and the provider is just so crucial, and that is the most important joint decision that you can make. So we want to help you to do that, so that we, the Arthritis Foundation, support improving all step therapy protocols that would ensure that you, the patient, can safely, efficiently access the best treatment that is available for you. So if you have experienced step therapy or you've listened to this training and you're thinking, oh my gosh, I think I've had to go through this before, or you've had difficulty accessing your medications in other ways, we really want to hear from you. We'd love to hear your story. It's so powerful and it helps us to be able to support you in passing legislation at the state and federal levels, as well as with the regulatory agencies. You can go to our bit.ly right here, Arthritis Story Bank, to tell us your story. And otherwise, you're welcome to give us an email or contact us anytime that we can be here to support you. You can email us at advocacy@arthritis.org. Thank you.